Hey everyone, I'm Kristen and I am a practicing registered nurse at Lakeland Regional Emergency Department. I am going to talk to you today about nurse leadership. The article I focused on was titled Nurse Leader Construction Process Barriers, and it was written for the Journal of Nursing. The primary objective was to identify barriers that we come into contact with that prevent us from becoming better nurse leaders. We should be focused on how to improve our leadership in everyday practice, and we should all be working with one goal in mind. That is to better our organization. We're focused on our patients, our families, our coworkers, and our leadership. When each nurse is focused on more than just his or herself, great leaders can be born. There were two categories of barriers identified in this article. The first was personal characteristics, and the second was institutional culture. Although they are two separate categories, they do feed off of one another and have an impact on the development of us as leaders. The four personal characteristic barriers are number one, professional and personal disengagement, meaning without the drive to become better or achieve more, stagnation is going to occur. The second is relationship difficulty, where coworkers are often not working together towards a common goal, or maybe there's issues between one another. Third, lack of confidence and professional knowledge is it's a strong personal barrier. We maybe don't feel worthy enough or smart enough to become a leader, when in actuality, we just need to be focused on learning how to lead with kindness, positivity, and integrity in every circumstance. Last, lack of creative problem solving. Creative problem solving is a barrier that hinders growth. In the emergency department, anything can happen at any moment. So we have to be ready to improvise and involve the whole team in changing up a plan to provide positive patient outcomes and even patient survival. The second set of barriers was institutional culture. The first one is duties that are not within our scope or in our job title. So we're not saying no to enough things, or we're taking on too much and we feel overwhelmed. The second is high demands or high workloads. Oftentimes in the medical field, we're very oversaturated with pretty sick patients. So we feel pressure, we feel overwhelmed and restricted on how much we're able to do for each patient. And that causes a lot of problems when we're trying to grow into a better leadership position. Lack of material or human resources. This will affect how we safely and effectively do the required job, and will often affect how we feel about how we are performing in our workplace. These three barriers all equal out to the fourth, which is dissatisfaction and discontentment in the workplace. The environment is not allowing the time and the resource needed for us to gain autonomy and become better leaders. It would be beneficial for management to evaluate how these barriers are affecting the staff and their ability to learn and grow. These were developed by practicing nurses, so I think the information is fairly standard across the board. Thank you for your time listening to me today, and I hope this pushes you forward in your job and in your leadership.